India was among the first countries in the world to prepare for an outbreak of the coronavirus pandemic, which has already killed more than 14,000 people and spread to 192 countries. India began screening people at airports from 17th January onwards, 6 days after Chinese state media reported the first known death from an illness caused by the virus, and a good 2 weeks before the World Health Organization declared it a global health emergency. India has conducted nearly 20,000 COVID-19 tests so far, according to the World Health Organization, which says that the country is responding with urgency as well as transparency. But so far, India has only reported 425 cases and 8 deaths, which many experts have deemed a very conservative number, given that India still hasn't been hit by community transmission. So how prepared is India for a full-scale coronavirus outbreak? Can our healthcare infrastructure handle it? According to data collected by the Union Health Ministry as of March 17th, there is one isolation bed per 84,000 Indians and one quarantine bed per 36,000 Indians. The data collected in the wake of the coronavirus outbreak states there is one doctor per 11,600 Indians and one hospital bed per 1,826 Indians. According to government data from the National Health Profile 2019, there are 11,54,686 registered allopathic doctors in the country and 7,39,024 government hospital beds. Health experts say that this data may have spurred Prime Minister Narendra Modi to appeal for social distancing and call for a Janta curfew in a bid to flatten the curve and space out the load on India's stressed public health infrastructure. At a meeting which Modi held with chief ministers and state health ministers, he said that India is currently in phase 2 of transmission, emphasizing that at present it is in the window for taking action to minimize the risk of transmission of phase 3. He talked about the importance of judicious use of health facilities and need to focus on ramping up quarantine facilities and isolation wards. For a population of 135 crores, that means health infrastructure is woefully stretched even during ordinary times. But in case of COVID-19, the additional problem is that the private sector is not yet a part of the management plan. That means only government beds are available for patients. But experts say India's responses to previous disease outbreaks have been relatively strong. When Ebola hit West Africa in 2014, India developed some good testing centers and protocols. When Nipah, a virus with a mortality rate of around 95%, hit Kerala in 2018, the human-to-human transmission was contained, although 17 people died. India needs to strategize nimbly and communicate openly and transparently to prevent the spread of infection. Being a vast country, actions and decisions will need to be decentralized but well coordinated. There's no reason to panic yet, but we need to be very vigilant and open about the spread and containment of the infection. To know more about phase 3 of coronavirus, please refer to the video in the description section below.